myPTsolutions Spotlight. I'm your host, Devin, physical therapist, and I just finished up a home health assignment over the last year and a half and learned some things that are unique to the home health setting. And I wanted to provide a couple of things today, three in specific. One is you're going to be required to use a bag in your home health assignment. Second is you're going to want to know what to carry in your bag. And third, you're going to be required to know how to use the bag appropriately to protect yourself and also your patients from infection while you're in the home and leaving the home. So first, the bags. Basically, there's two styles of bags that I would like to show to you today. One is the hand bag. This is the most common use bag, and you will be provided one by your home health provider typically. I've been on 4 or 5 assignments, and they've all provided me a bag. The bag is basically a over-the-shoulder type bag with, generally they have 4 to 5 compartments. This one has one Velcro in the back, one in the front, one in the middle, side, and then it has a handy little kind of outer pocket as well. So this is your standard over-the-shoulder carry bag. The second type of bag is more looks like a suitcase. Actually, it's made by Samsonite. I picked it up at our local Meijer. I believe it was on sale. I liked it because, first of all, this bag, you're not required to use a barrier because it has a hard surface. The wheels and this plastic surface provide protection on the bottom, which is kind of nice. Handy handle, so you can roll it along. And this one, as you see, has much more carrying capacity. So I probably lasted about 2 weeks in the field prior to when I had to kind of restock my bag. A lot more carrying capacity, can carry bigger items. For example, in the back, some starter carriers require you to have a scale. This one opens up so I could actually easily drop in a scale as well. And then it had plenty of room for different pockets to have clean and dirty fields. Pros regarding this one, obviously it's much lighter, much easier to get around, but you can't carry as much. This one, very heavy and actually quite bulky to get in and out of a vehicle. But just know you have options. So now that we've covered the bags, I want to cover what should be inside the bags when you go to your first home health visit. So I have kind of sectioned off into required items and then recommended but not essential items over here. So first, the required items. Obviously, you're going to have to document, so you're going to have your tablet with you. Barrier fields, they should be non-permeable. Blood pressure, stethoscope, thermometer, gait belt, disinfectant cloth, hand sanitizer, and gloves. All this equipment should be provided by your home health provider that you're going to be working for. On one exception, I'd recommend maybe considering an upgrade to a better stethoscope. The one I have here is just your average, almost throwaway stethoscope. I would recommend considering taking $25, $80 and getting yourself an upgrade. It's going to allow you to hear blood pressures and lung sounds a lot better. Couple of hints, I like to carry these in bags, and I just throw the whole bag, Ziploc bag, so I'm not digging in my bag trying to find one of these at a time. I can just grab a whole hunk of them. This is kind of bulky. I also recommend putting this in a gallon bag as well. It can scrunch and you don't mash up the box near as much. So these are the essentials. Let's move on to the kind of recommended but not essential. Footies, these are great when somebody asks you to take your shoes off and you don't want to walk around in your socks. An isolation kit, actually had to use one a couple of times. CPR mask, thankfully had not had to use one of these yet. And then little Band-Aid, also in here I have some 2x2, 4x4, and also would be recommended, which I don't have here, is some Curelex to help rebandage something, whether it's a leg or an arm, something to help keep the bandage on. And then lastly, which I don't have here, is a scale. Very handy for those CHF patients, which you might need to check and see if they've had an increase in fluid gain. So essential items and then recommended items. So now you know what should be in the bag. For today's just demonstration of the proper bag technique, I've chosen the over-the-shoulder bag. And it's important to note that there's 2 parts of your bag. One is the dirty part, which is the outside, and the inside, which is the clean part of your bag. So after I enter my patient's home, I'm going to want to clean my hands by going into the dirty part and accessing my hand sanitizer. I'm going to do that in a minute. before I go into the clean part of my bag. Now, if you're able to identify a clean, hard surface, this table would suffice. Tabletops, kitchen tables, anything like that are clean are acceptable as well. But I always like to be extra cautious and just put down another barrier just in case. So I'm going to reach into the clean part of my bag and grab 3 barriers actually. One for my bag, one for my clean field, and one for my dirty field. So here's my first barrier which I'll set my bag on. Second will be my clean field, and this will act as my dirty field. So I'm going to go into the clean part of my bag again and grab out all the supplies I'll need for the visit. I'll need my tablet, blood pressure cuff, stethoscope, thermometer, gloves, and sanitizing cream. Sanitizing wipe, I should say. And I'm going to take my hand sanitizer and place it on the dirty field. Then what you will do is you'll take your blood pressure and your stethoscope, and then you will do the blood pressure on your patient and set it back on the dirty field. So after I've taken it, I will then place it on the dirty field. Same thing with the thermometer. Grab the temperature, put it on the dirty field. And each time before I go into my tablet, I will, after I'm done with the patient, before I go out, grab my tablet, I will sanitize my hands. And then I always like to tell the patient I'm going to document what we just did so I don't forget, so I have an accurate record. Do that, and then set it back down on the clean field, and then continue on with your evaluation. Once your evaluation is complete, then it's time to sanitize or clean the dirty items. So after this is done, I'll set this here. When it's all done, I'll grab my gloves, because my agency has recommended I use gloves for this particular sanitizing agent. I'll don my gloves, and then I will proceed to clean my items. So that can stay there. See, this is a nice big pad. I love this size pad. It's bigger than any of the alcohol pads. I'll wipe down my thermometer, set it on the clean pad, wipe down my tablet. Some tablets require a different screen protector, a cleaner for the screen, which you also can carry. My stethoscope. Clean that off. And your blood pressure. This is kind of nice. Again, this bigger sanitizing pad works great. Just kind of wipe down like this on either side. Grab the tube. I like to just slide right down the tube and get the bulb. And then I will set it back on my clean field. Then it's important to let the sanitizer, most of the time the instructions are you have to let it dry before you place it back in the bag. At that point, then I'll kind of wrap up the session, talk to my patient about the next session might be coming up, what we'll be working on, and that allows time for the elements to dry. I will then remove my gloves, set them on the dirty field, take my items and place them back in the bag. So I've placed all the items back in my bag. The clean items going in the clean field part of my bag, and the hand sanitizer going into the dirty part of the outside of my bag. Then what I like to do is just fold these over. You can place this in the patient's trash. Thank you for watching myPTsolutions Spotlight. Our goal is to provide insight and encouragement for the rehabilitation professional. If you want more information about jobs or just job-related material, please check out our website at myPTsolutions.com. and where we have links to our podcast and blogs, which will help you out and give you more insight for your career. Again, thanks for watching, and stay tuned for the next myPT Solutions Spotlight.